So today we're going to talk about pancreatic cancer, the symptoms, the treatments available, and what the cell cycle has to do in relation to all of this. Well, first of all, to understand pancreatic cancer, we have to understand what the pancreas is. So what is it? Well, if you look at the image to the right, it's that long, flattened gland, highlighted in orange, that secretes enzymes that aid digestion and hormones, which in turn helps regulate the metabolism of sugars in our body. And pancreatic cancer starts when cells in the pancreas start growing out of control. And note that the pancreas has two main types of cell, exocrine and endocrine cells. And it's important to know if the cancer in the pancreas is an exocrine, which is the most common, or endocrine cancer, because each type forms different types of tumors. And as you can see in that diagram to the right, each type also has different functions. But overall, the symptoms for pancreatic cancer seem to be the same for most patients. There is pain, especially in the abdomen or the middle back. Patients start seeing the buildup of fluid in their abdomen. They start feeling nauseous. There's also fatigue throughout the entire body and a loss of appetite. And there is the production of dark urine, weight loss, and the yellowing of skin and eyes. As for the frequency of pancreatic cancer, it's quite rare. There are fewer than 200,000 U.S. cases per year, and as you can see in that little graph or little chart, the age group that's most affected is around 41 to 60 years and 60 years and up. But really, to understand pancreatic cancer, we have to understand what P53 is. And P53 is a very, very, very important tumor suppressor gene. And it's important because the product of P53 is a protein that suppresses cancer. So let's take a look at this through a little diagram. So first of all, when a cell's DNA is damaged, a sensor protein activates P53. So there you go. And this halts the cell cycle at the G1 checkpoint by triggering production of a cell cycle inhibitor. And this pause buys time for DNA repair, which also depends on P53, whose second job is to activate DNA repair enzymes. So if the damage is fixed, P53 will release the cell and allow it to continue throughout the rest of the cell cycle. But if it's not fixed, if the damage is not fixable, then P53 will play its final role, which is triggering apoptosis or cell death, so that this damaged DNA is not passed on and doesn't cause cancer. So recap, cell halts at the G1 checkpoint and DNA repair is activated. But if the repair is impossible, then the cell death is triggered. Okay, and in cancer cells, P53 is often missing, non-functional, or it's less active than normal. So basically, non-functional P53 results in the formation of cancerous tumors, or in our case, the formation of, pancreatic cancer. And according to researchers from Johns Hopkins, they discovered that the P53 gene suffers deletions in nearly 90% of pancreatic cancers. So that brings up the question of what can we do? So there's this thing called P53 gene therapy, and many experimental gene therapy approaches are based on repairing or replacing these defective P53 genes. But the great challenge of gene therapy is finding a reliable way to deliver the tumor suppressor gene to the cells that need it the most. But recently, researchers have tested a few different DNA delivery vehicles or vectors, and these are things such as non-replicating viruses, oncolytic viruses, or nanoparticles. And I'll take you through a little diagram to see how this works. So first, there's just, the gene P53, and then the P53 gene is encapsulated in an adenovirus. After that, that's when gene therapy comes into play, and then that infects the tumor cells, which in turn releases P53 gene into the tumor cells, and then the gene distributes this P53 protein into tumor cells, and then the tumor cells just disintegrate.